Hello, everybody. Thank you for joining us today for our final session in our Thinking Outside the Box webinar series. We will give just a few minutes for everyone to join, and then we'll get started. Once again, hi, everybody. Thank you so much for joining us today. We have a number of folks joining us from the waiting room, and we'll get started in just a minute or two. All right. Hello, everybody. My name is Charlie Francis. I am a Deputy Program Director with the Council of State Governments Justice Center. I want to welcome you today to fifth and final session of our webinar series, Thinking Outside the Box, Cross-Sector Strategies to Create Housing Opportunities. Really happy that you're with us today, and we have an interesting and information-packed session for you. Next slide, please. So today's agenda, after my welcome and some brief introductions, we're going to hear about some best practices around cross-sector collaboration from Brooke Page, the Southwest Regional Director from our partners at the Corporation for Supportive Housing, who have been key partners throughout this whole series. And then we're going to hear about a couple of key housing models and approaches that show particular promise in serving people with justice involvement and behavioral health needs, including the flexible housing subsidy pool model and how it's been implemented in Chicago and Cook County. And we'll hear from Julie Nelson, Associate Director for Illinois from CSH. And then we'll hear about the Just in Reach program in Los Angeles, from Stephanie Mercier, the Director of Impact Investing at CSH. So really today, we're going to try to give you an overview of how you can work together between the criminal justice, housing, behavioral health, and other sectors at the state community level to really move the needle and increase housing access and availability. And then dive deeper into how a couple of communities are implementing these solutions. So hopefully you can take a couple of lessons back to your own communities based on what they're doing. Next slide. So we are the Council of State Governments Justice Center. Quick write-up here on who we are and what we do. Next slide. And our equity and inclusion statement. Some very important commitments for us that we're very pleased to share publicly. So we'll just give you a moment to take a look at this before we move on. All right, next slide. And then this work is supported by the Justice and Mental Health Collaboration Program, which is part of the United States Department of Justice Bureau of Justice Assistance. And you can see a description of the program here. Again, it's really focused on innovative cross-system solution to improve responses to people with mental health conditions and substance abuse disorders for people involved with the criminal justice system. Next slide. And then JMHCP is funded and supported by the U.S. Department of Justice Bureau of Justice Assistance. Next slide. And our partners throughout this series and so much of our other work, and we really could not do this without them, is the Corporation for Supportive Housing, national champion for supportive housing, demonstrating the potential to improve the lives of community members by helping communities create real homes for people who desperately need them. So you can see a little bit more about who CSH is and the type of work that they do here. Next slide. So we have over 200 folks with us now today, which is great. I see that people are already doing it, which is great. So if you haven't yet, go ahead and introduce yourself in the chat and say hello, where you're from, your agency, city, state, what sector you represent. And particularly if you've been with us in any or all of the previous 4 sessions, we'd love to hear what have you learned? If you haven't, or if you prefer to share, what do you hope to learn today? And then again, I'm sure, it's an info-packed session as always, and we'll talk a little bit later about our follow-up office hours session. We have ample time for Q&A with our community presenters and subject matter experts, but we definitely encourage you to use Zoom's Q&A function so we can answer your questions live and or put them in the chat, and we'll do the best we can to answer these as we go. And if we're not able to, we will definitely address them in the office hours. Next slide. So a little bit more about where we've been. We started out giving a real framework about what states and communities can do to increase access and availability around housing using CSG's Action Points framework. And then we went a little bit deeper, because this whole webinar series is about pathways that states and communities can take to really increase that housing access and availability. So in session 2, we focused on prioritizing existing housing resources for people with justice involvement. And then session 3, we focused on how do you create more housing. So we gave a quick overview of key development concepts and housing models, focus on what justice system leaders need to know. And session 4, which we had just recently, was focused on making the case for housing, both as a good business investment and also on the human side. And again, using data and stories, both on the aggregate and the individual level. And so today, it's really about bringing all of these themes together. How do you put all of these pieces together, work across sectors to really position your state, your community, to move the needle in the long term to increase access and availability of housing. So hopefully you'll really be able to take that away from our webinar today. Next slide. So a quick review of our last office hours. Again, so webinar 4 was focused on making the case for housing. We talked a little bit about, funding is, perpetually one of the most difficult, if not the most difficult things to secure. So what type of funding methods, work in your community? One, we talked about the very successful social impact bond project in Denver. How that's showing really good and robust results in terms of housing retention, reduced recidivism, et cetera, for people with justice involvement. That was financed through a pay for success mechanism, which worked really well in that community. Other communities may need other funding mechanisms, whether it's accessing federal funding resources, local or state criminal justice funding. It really has to be tailored to your community. So we got into that a bit. Again, tailoring things to your community, finding the right team, especially the development team. How do you match your housing needs with the mission of the developer and other folks, the service provider? How do you get government officials on board to get buy-in, other funding agencies? How do you put that team together? And then we really focused a lot on data sources. How do you make this business case for housing? How do you look at criminal justice data, housing and homeless system data, emergency system data, to kind of look at folks, particularly folks who may be frequent utilizers of public services, look at cost and utilization data and be able to track that over time to show what a good investment housing really is. And then finally, We had Sally Lukin from Lukin Solutions show us a tool that can be used to really combine sort of individual level data anonymously, as well as some other data points to really be able to show how housing makes a difference at that individual level. Next slide, please. So again, just one more overview slide here, putting this action points framework to work. There are different pathways to increasing housing opportunities. If this was easy, we all would have done it already. We've talked about so far both prioritizing existing housing and supportive services for people who've been involved in the justice system, as well as developing new housing. Those are both important strategies, and I would argue that most communities need to be thinking about both things. But then today we're going to be talking about zooming out. What structures and processes do you need to put in place in your community to systemically facilitate access to housing? Who needs to be working together at the state and local level? How do you align funding streams and timelines? How do you look at policy barriers to housing in a holistic way and kind of work to address those? Those are the kind of things that we'll be talking about today. Next slide. So now I'm going to turn it over to Brooke to talk about best practices around cross-sector collaboration and key foundations for building strong community support.
For inviting the SH to be a part of this work. And again, page for pronoun Vegas. So shout out to all those folks on the West Coast geography. CSH, we're working nationally to really help communities to improve cross-sector partnerships, to increase housing for people with complex needs.
Oh, Brooke, I think we just lost you. Hold for a moment, please, everybody.
Okay, yay. Thank you so much. Sorry for that. I'm going to go off camera because I think I might have had a bad connection. You can hear me okay, Charlie?
Yeah, sounds good.
Okay, great. Well, like I was saying, we are working nationally to help improve access to housing for people with complex needs. And I'm so excited to be joined today by Julie Nelson and Stephanie Mercier, because we've got some really good examples to show what cross-sector partnerships can do in community. So we want to first start though with just level setting on some foundational considerations that you all can do in the small towns, the rural communities, and the urban core in which you all are represented on this call today. You all can start. You can start today, you can start tomorrow with setting up these types of cross-sector partnerships, because we know they work, and it's just a matter sometimes of knowing, like, where do we start? So let's go to the next slide and we can start talking about what this could look like in your community. So this webinar series, we've, like Charlie did this awesome overview. We've covered various trends to increase the supportive housing supply and community, right? There's different ways that this could look to increase housing. And it's important that we prioritize people who are disproportionately impacted by a lack of services, by a lack of housing access in our communities. We need the data really to help us figure out who should we be prioritizing. And we talked about that in our prioritization session. And we also talked about just the different pieces of what the continuum of care provides. There's housing options, there's rental subsidies that communities may have access to, but sometimes there's disconnect and there's a lack of coordination or collaboration to get folks from the institutions to get prioritized for some of those resources. Hopefully that session kind of provided some insights to that, how that can also be a resource. But we also emphasize the importance of what development can do. We could create our own lane and develop our own housing using single site support housing, right? But that requires collaboration with developers, with service providers, and property managers to really help us bring and pencil supportive housing projects. And so, one thing that I find that has been a consistent throughput of all of these five.
Okay, I think while we try to get Brooke's audio back, I'll just cover the next couple of slides. Since these are things that we've been talking about quite a bit lately. I think one thing that Brooke was
Charlie, are you
about.
there?
Yeah, we're here. We lost your audio again.
No, sorry about that.
I don't know if
So yeah, I think one thing. Yeah, can you hear me, Charlie?
yeah, just hopefully you can get in a spot with better reception.
Yeah, it says it's strong, so I'm not sure why it keeps cutting out. So I apologize.
Sounds good now, so hopefully it'll hold up.
Okay. All right. So that important structure. The first one.
Sorry about the
The
technical.
organizational structure to move information forward. Sorry, Charlie, hear me?
We lost you again, Brooke. Are you able to call in from your phone, maybe?
Okay. Yeah, yeah, that's a good idea. Let me call in.
Okay.
But the organizational structure, as I'm calling in, provides for an opportunity for us to just develop maybe an MOU. An MOU can help us, hold folks accountable, working together to increasing, so folks know what their roles are, how we can partner together, how we can really think about ways to improve our collaboration and our communication. We can also use a level of support in our communities. And taking a grassroots approach is also another piece of this support, right? We need to make sure that our community is educated on the housing that we want to create. We need to make sure our elected officials understand the housing that we want to create. And so creating that community buy-in and that community support is another level of just support infrastructure that we want to create, but we can't do that a lot of times by ourselves, right? So that multiple hands create light work. We want to be able to have those structures in place. And so these two levels of support is just something to think about. How do we create the infrastructure in our community?
Thank you for your patience, everybody. I promise it'll be worth the wait. Just give Brooke another moment to call in. If we continue having technical difficulties, I can always cover this piece. Brooke, are you there?
Yes. I'm on transitioning to the phone. So I'm sorry, everyone, for this. Goodbye. So if on next slide, if you can go to the next slide, we'll continue on as this trying to connect to the phone. Sorry. So part of the infrastructure as well is building community support requires us to
Um, I'm going to suggest actually that we move to the next piece, our next CSH presenter, and maybe while Brooke calls in, we can save this portion for the end instead and just restructure a bit. I don't recall if it was Julie. Were you next, or was it Stephanie? I think it was Julie. I'm forgetting now. I'm sorry.
Charlie, if you'd like,
Yeah,
I
Julie.
can briefly, and Brooke, I'm sorry, you're still having audio problems. If you'd like, I could briefly cover the slides
Okay.
that Brooke was planning to
Okay,
do, if that would be helpful.
Let's do
Thank
that
you,
then.
Steph.
Okay,
Yeah.
yeah.
No worries, Brooke. It happens.
Yeah, and thanks for your patience, folks. Sorry, this is I know we've all experienced it before, but we appreciate your patience. Sometimes the interwebs are tired despite all of our best efforts, right? So, hey, folks, I'm Stephanie Mercier. You're going to hear from me again at the end. I'm part of one of CSH's national teams focused on strategy and external affairs. And I'm so excited to be here having this conversation with you all and getting this chance to really talk about cross-sector partnerships, and also just this understanding that I know you all bring, that each of your communities and your specific programs has different needs and different opportunities, right? And really we're thinking today about how best to leverage those in the interest of bringing more housing aligned with services to your particular communities, right? And that support needs to happen at multiple places, right? And I know this is work that you know well, but both having the internal and organizational support to move forward an initiative, right? Because anytime we try to put together something like a housing partnership or doing it directly, like we have to have the space for that within the work that you already do, right? Because we all know that when we just try to keep stacking new things on top of what you're already doing, that we sometimes wind up in a situation that doesn't set us up for success. So what does it look like within your particular organization to be able to further a partnership and an initiative that you might be thinking about around housing? And then as you're looking to specifically create housing for folks who have had histories of justice involvement, what does that look like in terms of community partnerships, right? Where are there existing and natural allies? Where is there some work that can be done? And who can you bring with you to be part of that conversation? We can go to the next slide. And we know that's not easy, right? That are in many instances, folks are concerned about change that may be happening in their neighborhoods. And so we see things like NIMBY, right? Not in my backyard. Banana, which is build absolutely nothing anywhere near anything, right? And the the evolutions thereof. And so we know that that's real, and we have to, rather than just sort of being upset that those are the attitudes that communities bring, we know that that's real. We know that folks are bringing lots of perspectives to the table, and therefore we got to be smart and strategic, right, about helping to provide education and really working in collaboration with those in your organization and your community partners. And the ones that I missed, Lulu, local unwanted land use, and then nope, not on planet Earth. So the further evolution of banana. All right, we can go to the next slide. And when we think about what it looks like to put together this picture in the context of supportive housing and of financing supportive housing, we often talk about this as a three-legged stool, right? And some of you may have heard this before. So the things that we need to put the picture together and to give ourselves that solid foundation to sit on, to use our stool metaphor, is capital, right? We got to have funding that allows us to build or rehabilitate the physical structure. Sometimes we call that bricks and sticks, or we have to acquire existing housing, right? Sometimes that's a process too. We did funding that allows the building to be operated, right? So thinking about managing the property, keeping the lights on, upkeep, and often that comes from rent revenue, but we know that folks can't always afford to pay the level of rent required. So we also have to think about what helps to close the gap, right? Those are sometimes called rent subsidies. And then we know that folks need services both to obtain housing and then to sustain it and to be able to achieve goals they have in their lives around thriving. And so we need funding for services and service partnerships. And sometimes I like to add a fourth leg to the stool and make it a table where we sort of acknowledge that this doesn't happen in a vacuum, right? That it's part of the role of a community. And so really the community and those partnerships become kind of the fourth leg of the table, as it were. We can go to the next slide. And then, this is often one of the interesting challenges, right? And the reasons that we're all here together having these conversations is that there isn't just one easy funding source that gives us all of the funding we need to do supportive housing, right? That's true of many social programs in our country, and certainly very, very true of supportive housing. And that what that means is that we have to be flexible, we have to be creative, and we got to look at everything that's out there at your locality, at the state, and at the federal level that we can possibly use to put together this picture. Sometimes CSH calls this the supportive housing funding lasagna because of all the layers of that are required. And often it's helpful to sort of look in those three buckets that we talked about, right? Because those funding sources are different and they come from different sources typically. Now, sometimes we'll talk a little about this today, that we find creative ways to start braiding them together so it gets a little easier. But that tends to sort of not be the predominant reality in a lot of places. We can go to the next slide. And the good news is that while there is not enough, there are a fair number of resources out there. And in particular, we have seen some new opportunities from federal funds that have come through the Recovery Act, so sometimes called ARPA or Treasury for short, right? So there have been some recent new sources that have helped communities be able to advance some of these goals. But you can see that we're not going to go through all of these right now, right? But there are a fair number of sources out there that can be used for capital, some that can be used for operating, and some that can be used for services. And this is one of those questions that you'll answer for your specific community and project is, what do we already kind of have? And what's really a gap where if we found a way to fill it would have kind of a catalytic effect in terms of your ability to create additional supportive housing. And you'll hear both from Julie and from me when I put on my other hat and talk to you again, how a couple of specific communities have answered that question for themselves. We can go to the next slide. And just continuing the list of sources, right? So the previous page had a number of sort of federal funding sources and otherwise. We also know that our philanthropic partners play a key role, sometimes health funding partners, and certainly there can be state agencies and others that can provide funding for some of these needed legs of the stool. Next slide. And I was getting ahead of myself mentioning ARPA. So here's how some of those resources break down, right? There's HUD funding through something called Home ARP that can be used for capital. There have been what are called emergency housing vouchers that have provided that rent subsidy, right? So that gap filler between what folks can afford to pay based on their income and what it takes to keep the lights on in a given building. And then a number of states and localities have also had what are known as state and fiscal local recovery funds. A number of these, as some of you may know, are time limited, but they have been really significant. And these are great things to sort of ask about or find out who knows about how these are being used in your community or your state if you don't already. Next slide. And then we're thinking about some opportunities to pull together strategies that start to, as I was saying, make a little bit of this easier in given communities, braiding these funding sources together. And these efforts are always easier the more partners we can bring to the table, right? So I think just in my quick view of the chat, I see some of you, are coming from city and county government. Some of you are, coming at this from a justice perspective. Some of you from behavioral health or primary health care, right? And the more that we think about the shared stake that all of us with the various hats we wear have in helping folks improve their outcomes, particularly related to housing, to health, to employment, right, to those goals that they may identify for themselves, the more opportunities we have to think about who should really be part of that conversation. So where do our various systems have shared priorities that we can line up together, right? How can we identify places where folks' ability to access housing and attain services really is a goal shared by multiple system partners? And then from that, like 45 lists of funding sources you just saw, right? a long list, and that's good and bad. Where are there opportunities, particularly within your locality, to line up the timing of how folks might be able to apply for those funding sources? And you can play a role in that if you're the funder, right? Certainly if you're the funder of certain things, you have a unique opportunity to try to identify places where you could make it easier for your community partners to apply for multiple legs of the stool at once. But you can also be an advocate for that, right? And in putting forward what challenges it presents to not be able to do that from some of your particular resources, right? Same thing with application forms, either for funding, or this also applies when folks are given the opportunity to express interest in entering housing. Can we make it so people don't have to run all over town and apply 6 different places, but rather can do that in a common and streamlined way? And then can those applications, either for funding or housing, be reviewed in a common way? And then part of this is, how do we set ourselves up for success in a streamlined way on the front end? And then how do we keep doing that once a particular initiative is launched? And we'll talk about this within the specific context of Los Angeles too, but one of the most powerful things that your community can do in conversation with folks who may be experiencing the challenges that you're trying to solve in particular is trying to talk about, what is success like, right? How are we going to know it if we see it? If we do all this and we put a program in line, then how are we going to know if that had the desired outcome for people and for our communities? And so taking a minute to identify what those common outcomes might be can be a really powerful sort of tool in your community toolkit and in the diverse and collaborative table that you've set to bring folks to be part of that conversation. Next slide. All right. Well, I know Brooke, if she's able, will add some thoughts in the chat to anything that I may have missed from that. But
You did a great job, Stephanie.
Thanks, Brooke, and thanks again, you all, for your patience with the technical difficulties. We know it's happened to all of us, certainly to me too. So, Charlie, I'll turn back to you then.
Absolutely. It could have been just as easily me or any one of us. You know, that's just the world we live in right now. So we truly are a team. And thank you, Brooke and Stephanie, both. You know, I really like those 6 strategies in particular. I love that idea of aligning funding and timeline and processes, and then measuring outcomes in sort of this systematic, aligned way to really look in this holistic way, like how are we moving the needle on the housing front, like over time. I think that's really cool and has definitely inspired, you know, our own thinking here at the Justice Center. And speaking of things that I find very inspirational in terms of housing models, let's talk about the flexible housing subsidy pool in Chicago and Cook County. So I'm going to pass it to Julie Nelson from CSH to tell us more.
Great, thank you so much. And I am extremely glad to be partnering with Kayla Wallace, who's also on the line with us. Kayla is my colleague, who's the incoming 2023 chair of the Governing Council of the Flexible Housing Pool and a Flexible Housing Pool tenant. Because certainly, you know, it's great to hear about kind of the framework, but the most important thing is really the impact that we're having. So at a high level, just to kind of connect to some of the previous conversation that Brooke was walking us through with the slides and Stephanie presented on, the flexible housing pool really came out of a space where, looking at existing community resources and funding, that those resources weren't really lining up to meet specific needs of folks within Chicago and Cook County. And that really was the beginning of the flexible housing pool. So if you want to go ahead and go to the next slide. We have an overall vision, and our initial vision was to really promote this cross-sector investment and cross-sector collaboration so that we really had kind of a healthcare intervention that was centered in housing and housing-related services. So that really the goal is that we're getting to root cause of frequent healthcare utilization, justice involvement, getting to that root cause, which is housing stability. So from that initial vision, we've grown and kind of evolved so that our vision for 2022 and looking forward is really that all Cook County residents who are experiencing homelessness and who are really interacting with these public crisis systems have a stable home and have access to the healthcare that they need. And certainly across all of our partners, we have been challenged to think bigger, to think about what are these bigger community solutions to really impact more folks. So our big goal, which to be very transparent, we don't have the funding tied to this yet, but that's the challenge. This is what we are working towards, is that within 10 years, we want the flexible housing pool to be able to serve 5,000 individuals or households. Because again, we know what the need is. And until collectively, we are all able to go truly upstream, we know we need to go at this from both directions, right? The flexible housing pool is a solution for folks, again, who have this frequent healthcare or justice system involvement. And until we get to the solutions that go upstream, we'll keep having, unfortunately, more folks enter into the system. So we're trying to think at it from both directions. We also have our core values, which include, and really are centering on housing first, which you've probably heard about before. Absolutely racial equity, because in Chicago and Cook County, much like the rest of the country, homelessness and justice involvement is very connected to systemic racism in our communities and in our country. And so we are absolutely committed to, when addressing those disparities and partnering as a community to really do better and work differently. Our core values also include authentic lived expertise collaboration and then positive youth development. I'll talk in a little bit about some of our cohorts within the project that will speak to particularly the positive youth development and working with youth. Going to the next slide. I'm going to touch on this really quickly, just highlighting, and again, I don't think any of these are probably new concepts to anyone on this call, but again, just talking about housing as, the core component of social determinants of health, and what housing causes on the healthcare side is what we've identified with our local healthcare partners, that up to 50% of folks who are frequently touching the ER system are experiencing homelessness. We also know that folks have complex healthcare needs. Usually there's multiple diagnoses. And again, because our system fails people, that it leads to more complex chronic health conditions. And in particular, one of our partners at UI Health, they found that with their participation in a housing intervention, they actually saw a 41% ER utilization decrease and then 51% on inpatient side. Again, housing has also been shown to reduce lengths of stay for admissions, and that housing instability is also really related to high readmission rates, which again makes all kinds of sense. Because again, if I don't have stable housing, how can I get well? How can I recover? Moving on to the next slide. Again, so flexible housing, so as I talked about, is really honing in on and working to best meet needs for folks who have been failed by our system. And so getting trapped in the cycle of going through the ER, touches with the justice system, hospital readmissions, just in and out of the shelter system, in the healthcare system. And this intervention really is built to kind of provide that foundation so that then everyone can have the life that they want, which is what everyone in our community deserves. And so with that, we'll talk a little bit more into the nitty gritty, but I'd love to welcome Kayla, because again, like, let's get back to what this is really about, which is, you know, housing and ending homelessness. So thank you, Kayla, for joining us. And also want to give special thanks to Kayla because it's been a busy morning. Kayla is also very involved in the flexible housing pool leadership, along with many other things that she's working on and has going on. And just want to highlight again for everybody, I mentioned this earlier. So not only is Kayla a tenant in the flexible housing pool, she's on our lived experience advisory committee for the flexible housing pool. She was then elected to the governing council, which functions much like a board, you know, for those of us kind of in those spaces. And then in 2023, she will be the chair of that governing council for the flexible housing pool. So Kayla has deep knowledge and experience to bring to this table today. So I'm super grateful that she was able to join us.
Thank you, Julie. I appreciate that as well. Hello, everyone out there in computer land. So if you're wondering what that kind of looks like in person, you know, Julie talked about the different things as far as hospital visits and people being sick. You know, that first group that they brought in was chronically ill and homeless. And it is one of those things that is very challenging. So, you know, when I first got into this program, I honestly thought it was somebody trying to steal my identity because they just located me out of nowhere. It seemed like it did really kind of fall out of the sky. Once I learned what it was about, it did seem a whole lot more like a lottery ticket because, you know, it was kind of one of those things where it was a struggle. I mean, going back and forth to the hospitals, you're trying to figure out what's going on, and having something as simple as a place to go home to, somewhere where, okay, you can make appointments and get back and forth and say, oh, okay, now I can actually give an address, makes a huge difference. So for me, the flexible housing pool, I mean, I think it has been excellent. I honestly, when I first came into it, it was something that was very simplified. It amazes me that they got my name from, I guess, one of the social workers that, you know, happened to, you know, during my medical visits say, okay, hey, well, you know, where are you staying now? And there was no address or they couldn't find one. But also the thing that I think is really important to bring into the group overall is kind of almost decreasing that space in between the table. A lot of times, you know, I've been back and forth to meetings a lot over the last couple of years. And a lot of times it sounds like the group will often feel like, okay, there's a lot of space in between the table. It's always, how can we reach this? Or how can we do this? And ultimately, if you look at it kind of like, what do you need for your own household? How do you make your own house run? It's hard to make a household run without any kind of income. It's hard to make a household run if you don't have a household. So, you know, it's kind of eliminating those big things, the things that are actually a little bit smaller than probably what you think, you know, and digging into some of these major things. I think it's beautiful to have a lot of individuals coming to the table who want to help, who are passionate about what they're doing. And I am, you know, like extremely grateful. I love the fact that, you know, the flexible housing pool has, for me, the big thing that they did for me, even more so than housing, is return me to a sense of normalcy. So, you know, being a relatively young individual who ends up on disability, it wasn't expected, then, you know, I'm trying to get accustomed to, I spent 35, 40, almost 40 years trying to get into this person who I was, and then had to relearn who I am all over again, you know, with a different kind of condition. And so that was a challenge, you know, mentally, emotionally, all those different things that you're talking about. I will often say that homelessness is a mental illness of its own. It is the common denominator at the table. So yes, but those different things that make it different, as far as whether it's youth, whether it's someone who is ill, whether it's someone who's in the justice system, all of those things, those are the, you know, the details that kind of make it where, okay, you can kind of find your own niche. There is something for you to go into. And what I love, again, also is that it made a space, you know, without even looking for it, it made a space for me. How did I get into the chair seat? Still not quite sure, you know, but, you know, it was something that, you know, when they brought it to me, I was thinking, okay, I could probably do this in 2 or 3 years. It did happen a little sooner than I thought. So it was more like 2 or 3 months, but it still was like, okay. And I'm ready. I'm passionate about it. I think if you have an opportunity, I have not worked in, as far as in a system, as far as a job, in over, you know, a decade. So it has been challenging, you know, to, like I said, to be someone, a young person on disability, and you're like, okay, well, what am I supposed to be doing for the rest of my life? And out of nowhere, again, it kind of is a passion where it's like, I've been in this seat. I've seen it from both sides. Ultimately, you have to find those, you know, those things. I think it is important to have people who kind of specialize in an area. So if you are good with, you know, figuring out a system, put that together. If you're good with, you know, dealing with people, which all people aren't, then deal with that side of it. But everyone has something that they can do and add to. And so looking forward to this new year, going into the chair, you know, fingers crossed you guys be with me. But I am excited about it. I'm excited about seeing how this, you know, group is going to grow, how the journey is going to be. And I am extremely proud to be a part. Thank you very much. You know, so if there's any questions, please ask. Feel free to answer any of them.
Thank you, Kayla. And I might ping another question to you along the way. I know one of the things folks also wanted to talk about was a little bit of the background of the flexible housing pool. So I'm going to walk through a bit of that if we want to go to the next slide, just to kind of give you a sense as if you're thinking about, you know, in your own communities, how you can be creative, bring people together. You know, how Kayla was talking about, bring those different sectors and the different partners with different skill sets to those tables to then ideate and come up with what's going to work in your community. So for the flexible housing pool, we really started these conversations 2017, 2018 across different partners. Thanks to a funding from the JP and NPA Pritzker Family Foundation, we actually did a site visit to LA. And we went to go visit the flexible rental subsidy housing pool projects and a lot of the community leaders there to learn about what was going on. And we really modeled off of that work. So bringing it back to Chicago, you know, here's some examples of what was different in Chicago and Cook County. You know, we did not have the scale of the problem is different, which is great. I never want to see the scale of homelessness that's happening in LA happen anywhere else, right? Like, and so we have that as an asset. A challenge here is that we also don't have the resources. We did not have some of the tax revenue streams that were available in LA County or in LA City. And so this is where we just, again, kind of got creative with partners around the table to then figure out what would work well here. And so with that, really we moved towards the flexible housing pool really being created. So the first tenants were housed in 2019. The initial funder was the Department of Family and Support Services from the city of Chicago, with other funders coming to the table. And when we're talking about what the flexible housing pool is, you can move on to the next slide. It's using public and private dollars, bundling them together to then pay for the tenancy supports, the outreach, the engagement, the housing subsidy itself, so that it's all bundled and it's using a mix of these public and private dollars so that this project can come up with its own mechanisms to identify folks who might be eligible, because the traditional housing systems and the traditional funding systems weren't meeting these needs. So when Kayla talked about her lottery ticket, and I've definitely heard her, and actually, and other folks use that same analogy, which is fantastic and also heartbreaking, because housing should never be a lottery ticket. Let me just say that for all of us. Say that a few times. And recognizing for the flexible housing pool, how folks were identified, especially for that first cohort, was a data match between the Cook County Health System, and they also provide all of the healthcare in the Cook County Jail. So there was insight into touches with the jail system, touches with the Cook County Health System, and then touches with the Chicago and Cook County homeless systems. So it was a data match between those systems to identify potentially eligible folks. The fund then is able to provide outreach, so that when, you know how Kayla mentioned, somebody was like, Ms. Wallace, we have this offer for you. And she's like, there's no way this is real. It's because outreach workers were looking for folks across the city who really had no idea that they'd been identified for this project, because it was driven by a data match for that first cohort. So moving on to the next slide, I'm going to talk a little bit about our goals. Again, you know, nothing surprising here, right? We want to improve housing stability, end homelessness, improve health outcomes, increase that outpatient utilization, you know, because if I'm not going to ER and if I'm going to my regular primary care, that's really the direction we all want to be heading, to kind of make those shifts for where I'm getting care and how often, so I'm getting the right care at the right time in the right place. And we also definitely want to be decreasing any jail stays, emergency shelter days, those crisis services, and ED and inpatient stays to really kind of reduce that. So those are really our overall goals. And at this point, we really are looking at, there's 3 cohorts within the flexible housing pool. So the initial cohort that Kayla mentioned earlier, really anyone who met the data match criteria, ages 18 and up, but again, predominantly, most of the population were folks, you know, probably more in the 45 and up age range was kind of the more typical. Then there was a second cohort that the city wanted to prioritize, which is youth focused. So youth ages 18 to 24. Typically, we see more justice system touches with the youth cohort, because again, those chronic conditions haven't developed yet. And so it's really looking to get youth households connected to housing and housing stability earlier. And then the newest cohort that haven't started yet, but will be, is a reentry cohort. And so again, this will be folks specifically coming back home to Chicago and Cook County after leaving the Illinois Department of Corrections. And so that cohort hasn't kicked off yet, but the planning is in the works for that. And moving on to the next slide. I wanted to really recognize all the contributors to the Flexible Housing Pool Fund itself. You can see on our screen here, it's really a mix of public and private partners. You know, the City of Chicago, Cook County Health. We have managed care plans, accountable care organization, hospital systems, and foundations kind of all around the table together. I'm going to go to the next slide. And then you can see, I want to especially highlight the lead entity for managing the flexible housing pool itself. So all of the operations and ensuring that all of the housing is secure, that the case management and outreach are all provided. The Center for Housing and Health is the Flexible Housing Pool Coordination Agency. So they're the lead for implementing everything related to the flexible housing pool. And then just recognizing other planning partners at the table. Moving on to the next slide. Again, I won't do kind of the deep dive on this, but it really is multiple stakeholder, multiple sector, investment, where the funds are all then held in an escrow account. And then the Center for Housing and Health is able to draw down those funds to ensure that the tenancy supports, the outreach services, and the landlords kind of all get paid, and that it's all coordinated on their end. Next slide. A little bit more about how it works. Again, the clinical services are typically provided, and so when I say clinical, that's any of my healthcare needs, my primary care, my psychiatrist, my behavioral health care, my specialist that I'm going to see. All those clinical services are really coordinated, and they support folks with our clinical partners. So that's why having those hospital, FQHC, MCO partners at the table is really important, because that's kind of their lane and their expertise. And kind of a core component of this model is that everyone works together but has a lane. And the Center for Housing and Health, they're working with those funders and using the funds to then ensure we're getting landlords and units secured for tenants. And then it's also funding all the ongoing tenancy supports, so that if I need support around budgeting, for example, then my case manager is working with me on that, or working with me on those issues. Also for outreach, they're coordinating all those pieces. So next slide. So at this point, we actually have over 30 million committed to date to the flexible housing pool. It's a continuing evolution. We are constantly fundraising, and it will continue to grow. We have scaling plans, and we have no intention of slowing down those scaling plans, because we know there's the need. We're not fundraising to fundraise, we are fundraising to end homelessness for our community members and our neighbors. Next slide. And coming back to kind of what Kayla spoke to earlier, we have our governance council, and that is kind of the lead decision-making body. A quick update on this piece is actually 40% of the seats are for folks with lived expertise. So right now there's 4 seats at the governance council, and then 60% of the seats are funders. So people like me, not at the table. People like me, we're advisory members, but again, the decision makers are folks with lived expertise, FHP tenants, and investors. This group meets quarterly, and they really bring kind of that high level decision-making guidance, oversight across the project and across all of the funders. So with that, I would love to close with maybe one last question for Kayla. So Kayla, when you think about the flexible housing pool, housing is one piece of things, but life doesn't stop with housing. So how have you used housing as a platform for all of the other great things that you have been doing, that you're working on, your goals? Could you speak a little bit to how I've heard you talk about that before.
Yes. So definitely, coming in from everything from like she's already spoken about lived experience, which literally is all in the title. LEAC is the Lived Experience Advisory Council. And it gives you those people, anyone in this group, I'm sure out of the whole 239 participants that I see involved here today, anything that you've experienced, if you prefer to even talk to someone who's went through it, someone who's gone through what you've gone through. So whatever that is, it doesn't matter what it is. And it's one of those things where, okay, I think for me, it's helped because like I said, it gave me a place of stability. So I could focus on things that I wanted to focus on, which is helping someone else to be able to have it, to be able to have everything come in this one package. So where, I'm sorry, the other part of it is you also have like, what was that? Okay, I'm sorry, that's someone else asking me something. The coming with not just the governance seat, but also talking about things that we've also done. We've done I think it's important to help people to help themselves. So we've done things on skill building where, you know, you're giving people not just the things, but helping them to learn, educating them, so that a lot of times the reason why people are not doing better is because they just don't know any better. You know, even the systems that we already have in place. So for example, in my particular story, I came in and FHP was the main funder, but then they connected me with another subsidy that also helped, so that, you know, as time goes on, I don't have to come out of the FHP pool, so to speak. You know, that can be put towards another participant, but they also helped me to get myself stable so that I could have it somewhere else. And so I think it's, you know, one of those things where, you know, any of it is going to be a help. If we help each other, technically, I think it's the way it should be anyway, but it's one of those things where we all have something to give. You know, everyone has something to give and they're good at something, and you give that. You don't have to do 25 jobs. I guarantee you, you know, as many of us that would love to have 20 Julies on our team, you're not going to have 20 Julies on your team. You're not, you know, she's that one individual, okay, that's gonna, you know, man, bang out every single thing. But most people aren't capable. It's like, okay, they're good at something, and let's do that. I think I've heard a lot of that, even talking about the partnerships of different people coming together in different ways. Figure out what's on your board. Figure out who's on your team, who plays what role. And if you're good at that role, then, you know, make something happen. You know, do the best that you can do. It's, you know, it's not going to be perfect. It's not going to come overnight, none of that. But if you are honestly trying and you're trying to put something out and you're making an effort, those things will come to pass, and we'll figure out what works and we'll figure out what doesn't work, you know. But those are the things that I think would be majorly helpful. I think, you know, having that stability though is a key point. You know, it's kind of hard to be worried about who else doesn't have housing if I don't have housing myself. So, yes.
That's the perfect ending note for our section of this conversation. So thank you, Kayla. And Charlie, I will hand it back to you.
Thanks.
Great. Thank you so much, Julie and Kayla. You know, it's great to hear about how this work is expanding and taking off in Chicago. And, you know, thanks again, Kayla, for sharing your story and experiences and for your leadership. Thank you both. So now I'm going to pass it back to Stephanie again, wearing her other hat, to tell us more about the Just and Reach Permanent Supportive Housing Project in Los Angeles.
Oh, that's great. And I'm gonna first I'm gonna just say, Kayla, you're getting so much well-deserved love in the chat, but just what a gift it is to have shared this time with you, and really appreciate your words. And it's given me, you know, some perfect jumping off points for this part of the conversation too. So thank you so much for sharing your wisdom and your expertise with this group and with us. Brooke, let me see if your audio situation has changed, and if so, if you want to jump in here. And I think we can go to the next slide. We actually don't have slides for this piece, but we're going to share, there may be a placeholder one in here we can look at. All right, Brooke, I'll see if the interwebs are being kinder to you now.
I know. Can you hear me now, Stephanie?
So far, so good.
Let's give it a shot.
Thank you all so much for your patience with this technology. But Stephanie, so we know that there's been some really important work happening in Los Angeles, and we are excited about a recent report that we're going to share with this group around just and Reach and what it's all about, Pay for Success structuring. Can you provide us with an overview of Pay for Success and the Just and Reach project and kind of what it's all about?
Yeah, I'd love to. Thank you so much, Brooke. And I think, you know, Kayla really put what I was thinking about saying into words so well, in terms of the opportunity that every community has and every person, right, to look at what are the specific strengths that are already there at the table. What are you bringing, or what is your community bringing, and how can we really build on those? And one of the things that I really appreciate, and I'll just give a little bit of framing, right? The program that I'm going to share about is called the Just and Reach Pay for Success Initiative. So it is using a pay for success approach. Some of you who have been on previous webinars may have heard a little bit about that. But I'm also going to talk about pieces of that initiative that apply whether or not your community finds that pay for success is an approach that makes sense, right? So it might, and Charlie, I think you put that really well at the beginning. It could be that that's a tool that could be helpful for your community in scaling. It also might not be, right? And there, I'll draw out the pieces from this particular initiative that, at least in my opinion, apply regardless of the size of your community and regardless of whether or not that particular tool is a thing that makes sense for you, because it doesn't in every case, right? And that's part of the option here too. So I'll come back to how this sort of builds on the strengths in that community in a moment. But at a very high level, the Just and Reach Pay for Success initiative was a project that ran primarily between 2017 and 2020. And has recently, very excitingly, been able to publish and share some results. And so I think the good folks at CSG will put links to 2 different reports in the chat, and those will have much of the content that I'm going to share, plus a lot more in case you have additional questions or want to do a little further reading. So we'll get those in the chat for you during the course of this conversation. So it took a pay for success approach and provided housing to what ended up being 349 individuals. And as you've heard in the description that Julie shared too, similarly, folks in this initiative were identified because of their involvement with the Los Angeles County jail system. So because they were exiting jail, and also because they were coming with disabilities and with a history of homelessness, right? So folks who had not experienced previously the best of what systems may have had to offer, and had an opportunity to kind of participate in this particular initiative. And I'll just mention, we're not gonna, we could do a whole webinar on pay for success, and that's not what we're doing today, but I'll just mention that that financing approach does 2 things primarily. So it takes this idea of a performance-based contract in which funding is provided contingent on a level of success that everybody around the table has agreed to being achieved or not. And then some investors who also share the view that those outcomes are important and achievable and are willing to provide money upfront so that that initiative can be put into place, and are further willing to have the repayment of their investment be based on the extent to which that project does in fact achieve those outcomes. So you may have heard the term impact investing, which is a broad brush term that sort of talks about using dollars in a way that cares not only about financial outcome, but also social outcomes, right? Or doing good things in the community. And pay for success is a specific approach that kind of falls under that broader brush. We'll get into some more pieces in a minute, but yeah, Brooke, I want to let you guide me.
Right. So this is some really innovative strategies of thinking about performance-based contracting through a pay-for-success model. But how does it come together? Like, who were the cross-sector partners that were instrumental in this initiative? Because we talked earlier, and Charlie had that framing just around this need for cross-sector partners and even to get work done. Who was instrumental in this project?
Yeah, thanks so much for that question, Brooke, because like you heard from Julie in her description, right? It really takes a village to make these kinds of initiatives happen. And this particular project in Los Angeles arose in a similar time frame to a new division that was put into place within Los Angeles County, which was called the Office of Diversion and Reentry, which is interesting on its face, right? But is further interesting because that division is part of the Department of Health Services, right? And I want to pause on that for a minute, and we're talking about it again in a different context. That it under this broader umbrella, right, of health, we're thinking about opportunities for folks to be diverted and to receive other supports around justice involvement, right? And sort of thinking about that holistic view of understanding how systems can work together. So the Office of Diversion and Reentry in LA County were, of course, key partners, as were the Los Angeles Sheriff's Department as part of this initiative, thinking about the government side of this. And then we talked about, because this is a pay for success model, that there were upfront investors who in this instance provided $10 million that did in fact get repaid. I can give you the end of the story now. Sometimes we don't know when we're in the middle, right? But did in fact wind up being repaid based on success. And that money came from United Healthcare. And I want to say that out loud again, right? United Healthcare, they're an entity that is focused on health and still understood, right, the power of thinking about putting some of their dollars to work in an initiative like this that targeted folks who had involvement in the justice system, as well as, right, health and other related challenges. So they were one of the investors, along with the Hilton Foundation, who folks may have heard of, but certainly are instrumental and very integral in the Los Angeles community and elsewhere in particular, right? But a really nice partnership of healthcare organization who shared that goal around outcome focused financing, and a really of the community foundation there too. And then of course the providers of housing and services, right? None of these initiatives happen if there isn't, or if there aren't organizations who can help work together in collaboration with folks to help them achieve their goals. And so Brilliant Corners manages the flexible housing subsidy pool. And I'll talk about why that's important in a minute. And then there were a number of organizations that there are, call it intensive case management service providers, so ICMS providers that provided supportive services. And I'll just mention briefly here too, this is actually kind of an interesting full circle conversation. So you heard Julie talk about how the Cook County project was inspired by the Los Angeles flexible housing subsidy pool. And in fact, the Just and Reach Pay for Success initiative scaled up the Los Angeles flexible housing subsidy pool, right? So it used that existing architecture of this successful flexible housing subsidy pool and said, hey, there are more folks who could benefit through the flex pool that we want to provide resources for in particular. And so rather than sort of reinventing the wheel and creating a whole new initiative, they did that look that many of you were doing and said, oh, we have, right, all of this collaboration that has already gone into this structure. How can we use these existing partnerships with our ICMS providers, these existing structures with management by Brilliant Corners, and help this program help that, right? And so it took this approach of scaling existing initiatives, which is actually pretty unique in the pay for success world. A lot of times we're kind of creating new, and that's great too, right? But I share that because that may be relevant for you all as you're sitting thinking about, what does this look like for you? Is there already a successful program that really could just benefit from the opportunity to scale, right? Are there existing partnerships that get you part of the way to where you want to be, that you may be able to scale up? And so that's always been one of the features of the Los Angeles initiative that I found really interesting, is that it sort of worked through these existing departments and initiatives to kind of scale those up.
Wow. Really great. It just brings me back to that slide around the three legs of the stool and the fact that you have this community robust table with healthcare, reentry, private public partnerships with the healthcare, United Healthcare, and then, like you said, the providers of services and using Brilliant Corners. So really great, robust community table that's being built to do this work and to scale to meet the need. So what were the key outcomes? So all of this collaboration, what were the key outcomes from the project, and why were those outcomes so important?
Yeah, thanks for that, Brooke. That's such a great question. So in this, and you've already heard me now a couple of times talk about, right, how I think one of the pieces of the pay for success puzzle that really any community can take, whether you do any of the rest of it or not, is this opportunity to bring together diverse partners and have a conversation about how you hope the world looks a little different at the end of a particular initiative, right? And so define some shared outcomes that you're going to pay attention to over the course of a project being put into place. And in the case of the Los Angeles Trust and Reach initiative, the two outcomes that were focused on in particular, and that were the basis for whether or not the investors were repaid, were housing stability, right? So supportive housing initiative, not a surprise that we know that having access to and being able to sustain housing is critically important and leads to other outcomes. And then also in the case of this, the other outcome was essentially avoiding returns to jail, right? So for folks who had previously had those interactions, the hope and goal was that folks were able to avoid or have a minimal number of returns to jail. And so those were the two targeted outcomes that were looked at over the course of a period of time. And we saw that, and the specific details of this are in the reports being shared. But we saw that folks did, in fact, enter housing and stay housed at a high rate, and that the level at which folks were able to avoid arrests, in fact, exceeded even the baseline expectations that we thought folks would have. So the estimates were that 43% of folks who participated over a 2-year period would have no rearrests. And in fact, it wound up being like 56% of folks did not have any returns to jail during that 2-year period of time that was measured. I should also say too, those were the outcomes tied to payment. There was also a broader impact evaluation conducted by Rand Corporation. I think that link has been in the chat too. And that evaluation looked at sort of shifts in services that folks used and related cost offsets that resulted from that. So we also have kind of that broader piece of the puzzle. Thank you, Thomas. Thomas just put that in the chat as well.
Wow. So not only did you all meet the benchmarks around housing stability and avoiding returns to jail, but you exceeded those benchmarks. So that's awesome. Really great. So thank you for the report. So I have a couple more questions for you, Stephanie. What were the structures for accountability? Like, how did you ensure that all of these partners were going to pay those success payments, or were going to ensure that the performance was actually met? And then, like, what changes were made over time to kind of ensure that this accountability was in place?
Yeah, thanks so much for that, Brooke. So I now get to talk about my other. I have several favorite things as you all will learn about Pay for Success. And again, this is another one that I think applies whether or not you kind of take the whole financing structure of the model, which is this idea of like, okay, so we sat down with our group of partners and we said, hey, here's the success we hope happens, right? And here's how we hope the world looks different at the end. And then you actually got to measure to what extent that's happening, right? And so in this particular initiative and in all Pay for Success projects, and in fact, in the project that Julie talked about as well, there's this opportunity to pull together a group of folks. So Los Angeles had an executive steering committee, which included all of those broad range of partners that I was speaking about, as well as an operations committee of those folks who were primarily doing the work on the ground. And those groups of folks met for some quarterly, some monthly, but for the duration, of this 4-year initiative. And part of what we did when we met is look at, okay, if these were our goals in terms of housing stability and in terms of the avoidance of returns to jail, where are we, right? And if we're not where we thought we would be, why? And what opportunities exist to make changes and to strengthen the program, right? And I think sometimes I'll mention this because I think a lot of times what happens is that we do all this work, right? We set up the outcomes, and then maybe we're lucky enough to get a grant that funds it, and 2 years later we sort of look back and say, well, did we or not? And at that point, you learn something, but you didn't get the chance to necessarily adjust in real time. And so I think there's a lot of power in, once you bother to say, these are the outcomes that we think matter, figuring out what's simple. It does not have to, be hard or complicated or involve a formal evaluator, although you can. Evaluation is great too, right? But what is the opportunity in your community to kind of look at a shared set of metrics that help like, we thought this was going to be how quickly we got folks housed, or we thought this was how long folks were going to stay housed, and we're not there, and why? And how can we change that? And so in the context of the Just and Reach program, and Brooke, you talked about some of the benchmarks that were exceeded. There was also a benchmark that was not, right, for a variety of reasons, but the level of folks staying housed for 12 months was not at the level that we initially expected. And part of that is that, folks, when we create these initiatives that are really prioritizing individuals who have had a lot of, previous system involvement, sometimes that looks different, right? When folks enter housing and different supports are needed, we have to be nimble. But it also created this opportunity, along with other analysis that the Office of Diversion and Reentry was doing of their housing program, to say, where can we make changes? So certainly not solely attributable to this initiative, right? But it was one data point among many. And they said, you know what, we think the folks who are being served through these ICMS contracts need additional support. And so they globally said, rather than kind of funding that support at one staff person to 15 individuals, or I'm sorry, one to 20, they reduced that to 1 to 15, right? And sort of looked at their system and said, hey, we're getting data from this initiative, we're talking to people, we're seeing other things, and we want to make a change to the initiative that we put in place that we think will strengthen it. And I think that's really to their credit, and a number of other changes that they made within that initiative, to not just kind of wait right until the end of a program like this and other programs they were running, but rather to say, what else can we be doing now to help support people and really strengthen them as well. So I think having those structures and space for conversation, right, however you do it, can really just help get closer to those outcomes that everybody wants to have.
Right. So being nimble to make those adjustments, and how innovative to recognize that it's really lower caseload sizes that will help us meet this goal versus, expecting folks to do more with less. So I think that was an awesome just example of, making those adjustments. So thank you. So our last question before we turn it back over to Charlie, and I would love for you, Stephanie, if you could just maybe give some advice to all of these communities that are being represented on this call today. There was a question around identifying funding, like how folks can really do that, to maybe consider doing a flexible subsidy pool in their community. What would you recommend, or what are some ideas that you have around strategies for identifying funding? Maybe something that the LA folks did, of how they got those funders to the table in order to scale supportive housing.
Yeah, it's thank you, Brooke, for that question. So I think another thing that was interesting about this initiative, and again, there are likely similar things that are relevant in your community, is that they really sort of established this goal, right, of providing additional housing opportunities to folks who were coming through the Office of Diversion and Reentry, and then sort of looked around and said, what are all of the ways that we can potentially do that, right? And so one way was through using this pay for success approach, but that also dovetailed with two additional funding opportunities that were available at the time and that they were successful in receiving. So one in partnership with CSH was a grant through HUD and the Department of Justice, who provided pay for success supportive housing demonstration grants. And so this project was able to utilize some of those funds, towards the success of that initiative. And then also from the state of California, an entity called BSCC likewise made awards related to pay for success, and so that award came together with the funding from the investors to kind of all work together towards that successful initiative. So I think that's one example of looking around at sort of state and national funding opportunities that might align with what you're trying to do. But I think, as you heard from Julie, and as you saw on the spreadsheets with all of the different funding sources, you can also start smaller. So we're also involved in an initiative in Indianapolis where they have created a flexible funding pool called the Housing to Recovery Fund that started with philanthropic resources led by the Central Indiana Community Foundation, and has since added in funds from the city of Indianapolis. But I think that there they also saw the power in saying, here's a need that we need to be able to more nimbly meet there around services, and identified partners. And that work continues, right? They continue to engage partners. And as you heard from Julie too, the efforts to scale are ongoing. So I think start with who you have, right? Regardless of the size of your community, who are those partners and funders who have a shared interest in meeting the needs that you've identified?
Yeah, I love that. Really start with what you know. What do we have? Who's interested? Who are those stakeholders that are already bought in? How do we get them to seed something to scale and have the conversation? So thank you so much, Stephanie. Thank you so much, Julie. You all are just doing amazing work in the community. And I'm going to turn it back over to you, Charlie, so we can wrap up.
All right. Yes, thank you so much, Stephanie. That was really great to learn more about Just in Reach, kind of what makes it work, how it's connected with other programs, especially the Flex Pool, and how, these types of approaches can work in different communities. It's just, it's not just an LA thing, right? This is how it made it work in LA, but there's different scaling options, different funding options. It's really taking the bones of what made something work and adapting it to your community. So yeah, just a few more minutes, next steps and resources to wrap up our series. I can't believe it's over. We would love, as always, this has been an info pack session, so we would love you to join us for a final office hours session. We will have some folks from CSH back to take your questions and to dig into more of these issues and themes in depth. Want to learn more about flex subpools or pay for success or how to develop a governance structure? This is your chance. So if you're registered for this webinar, you'll get the registration link in an email as well. Thursday, October 6th at 2 p.m. Eastern. Please definitely join us. Next slide. And then we just have a few different resources to quickly share with you. We have a technical assistance center where you can, we have our office hours registration link in the chat as well. A technical assistance center where you can come ask your questions at the intersection of justice and behavioral health and get free technical assistance from our agency. Next slide. And some other resources. We recently put out a brand new article directly based on work with CSH in this webinar series, as well as a community practice we did last year, focus kind of on summarizing some of the best practices for creating housing opportunities for people with complex health needs, leaving incarceration. Hits on a lot of the same themes that we talked about today in a real concentrated way. It's a great quick piece to kind of distill down the essence of what we've been talking about. And we'll be putting out 2 more of these posts this fall. Next slide. Next slide, please. And just going to show you a few other resources here. Another webinar that we did a while back focused on gaining buy-in for affordable housing for mental health diversion. Next slide. All of the recordings for this webinar series are going to be available on our website. The link is already up. The first 4 should be available, and this one will be available within 1 to 2 weeks. Next slide. And then action points, the brief, which underlies this whole series. This is also available on our website. It's a concise framework for expanding access to housing for people in the justice system with behavioral health needs. It's directed towards state leaders, but it's really pretty broadly applicable. Next slide. And then we have also a nice summary on our website on ARP funding key opportunities in different areas, including housing, if you want to use that as a quick reference tool. Next slide. A lot of resources for you today. And then CSH has just an absolutely huge library of resources on this topic, and we have just a few of them linked here. Next slide. And then finally, HUD on their HUD Exchange, which is their technical assistance site, has a page dedicated to preventing homelessness among people leaving prisons and jails that features our resources as well as some others. Next slide. So thank you so much for joining us today and for this series. It's really been a pleasure to be able to be with you. We wish you the best of luck in doing this important work in your community, and we hope you will join us for our final office hours session. Thanks again. Have a great rest of your day.